All right. So tonight I want to talk about brain health and what you as an individual can do to improve your brain health. This is a cartoon from a summary published in Lancet Neurology in 2020 that took all of the information that was available, reviewed it, and came up with what they feel are the most important modifiable risk factors for dementia. And this is one of the things that we're moving towards. And I'll talk a little bit more about that in a second. But that I would encourage you, if you're interested in doing this, in this topic, because I think it has relevance to your day-to-day life. But you can see that it influences happen in early life, middle life, later life, and of course, towards the end of life. Things that I think might be important that we don't think much about is hearing loss and social isolation, air pollution. These are things that haven't quite gotten to the forefront. I think you probably see them in health news, but so the importance here is that this is very much on the minds of scientists, that there are different ways to approach this. And I'm going to go over this multiple times during our talk, how we can change, how you, working with us, can change society and public health to improve our brain simply by paying attention to what needs to be done and in acting on that at the ballot box. I know that's the whole political. That's it. I'm done. No more politics. One of the things that where does this come from? How do we understand dementia, and where does it come? Does a risk factor or understanding risk come from in Alzheimer's disease? And it comes from studies like Mia Kiva-Pelto and Dr. Rachel Whitmer, and that is looking at people's life experiences and how they impact their risk for dementia later in life. Dr. Kiva-Pelto is Finnish, and they have a Finnish registry that people have, and so they were able to look back in their early life, midlife, and look at factors that predicted dementia. Dr. Whitmer has oversees a very large study through the Kaiser system, similarly having recorded information dating back 40, 50 years. And then they use that to predict, and they come up with these scales. And the important point about these scales is, well, we can't change age, and we can't modify age. But there's education, there is cholesterol, there's your weight, there's your blood pressure, and these can all add up to predict. And what's beautiful about this particular prediction score is that it's called what we call linear. So your risk is directly related to how many of those risk factors you have. So why are some of these things important? So we know that age is the number one risk factor for Alzheimer's disease, okay? But aging is also associated with other diseases, such as a stroke, okay? It's not quite as big at the population level, but it's age-related. But coronary artery disease and in particular hypertension are very strongly related to the aging process. As we get older, the likelihood of developing hypertension goes up. Now, this may be changing, and I'll show you some stuff about that. Why is that important? Because it looks like, and this is my colleague Sudha Seshadri at the Framingham Heart Study, looked at what's the risk of someone who has neither stroke nor dementia and following them from age 65 until they die, and what's the likelihood of them having a stroke or developing dementia. And as you can see, both are co-occurring, they're not occurring in the same individuals, but they're both going up dramatically with age. And in fact, it is really almost more likely that a man's going to have a stroke than develop Alzheimer's disease in this particular group. That doesn't mean that it's all going generalized to everybody. But these are two things that commonly occur, okay? Why is that important? because the likelihood of vascular risk factors, which lead to stroke, also increases your risk for the clinical diagnosis of Alzheimer's disease. Okay, so that's shown here on the left, and that's the Rachel's data from the Kaiser studies, whereas Jose Luxenger's data from, which is only 23% Caucasian, so it's more diverse. That same relationship is actually increased. So because the prevalence of these diseases are higher in Black, African, and Hispanic Latino Americans. So that's just what the prevalence is and how it influences. It's not whether you're white, black, or green, or blue. It's what the prevalence is in your particular population or culture. It's relevant for the following reason. When we look at people who come in and we say, you have Alzheimer's disease clinically, you've gone and you've seen me, you've seen, anybody. It turns out that actually, if you are generous and give your brain for research, this is what we find, that there's a very small number of people who have no pathology whatsoever, but that there is all kinds of other pathologies here. And if this was working well, I would be highlighting each one of them and ticking through them. But you can see there are all a bunch of them. And what's really important is that there's often a mixture. Okay, so Alzheimer's disease, when we say Alzheimer's disease is the most common cause of dementia, that is absolutely correct. But Alzheimer's disease alone is not the most common. And in fact, when you add up vascular disease, this is what happens. So vascular disease plus something else is the most common cause of Alzheimer's disease. And the big three is Alzheimer's disease, vascular disease, and Lewy body disease. Okay, so why is it important to understand that? Vascular disease is the one modifiable risk factor that each and every one of us can move the needle on, so to speak, vascular risk. And I'll show you how that's done in a bit. So vascular risk factors are common as we get older. They actually, some of the research we've done in the Framingham Heart Study suggests that they begin to have effect even in the 40s and 50s. Okay, so they're common, they influence your brain, and they often occur with other pathologies like Alzheimer's disease and Lewy body disease to make the likelihood of dementia greater. So if you have a certain set of risk factors and you add vascular disease to that, that's only going to make it more likely that you'll develop a dementia. Risk factors that are not modifiable are things like family history or a genetic risk. Okay. And so the concept here is this concept of cognitive aging is this notion that if we take that blue line, okay, that's sort of we grow up to our best and we maintain our best for a certain degree of time. I know I don't make it very long. I'm hoping mine's a little straighter. I don't know yet. And then we start to decline, even if we're, quote, healthy. And I think most of us who are here, and I see this in myself. I mean, I'm not as sharp as I was. Okay. I can't do the things I play these games and these kids get on and they do it in 2 seconds and I do it in 2 hours. And I'm just like going, oh my God. That change may be modified by concurrent diseases such as hypertension, such as Alzheimer's disease, such as Lewy body disease. And in particular person, they can vary quite considerably. Does that make sense, you all? Okay. So the idea here is to reduce the injury effects so that we can maintain the brain. Make sense? And this has in its basis what we call the heart-brain axis. There's a heart-brain axis, there's a lung-brain axis, there's a kidney-brain axis. Guess what? There's a gut-brain axis. Guess what? They all have in common? The brain. Okay, so the brain is really important. Can we modify these? This is NHANES data that is a national survey that's done every few years, has been going on for, golly, I don't know, since 1960. And what this is a population-based, random-based, population-based study that just simply looks at certain behaviors and certain measures of cardiovascular health. And what these two graphs show is that if you look in the blue, that was that's in 1988 to 1991. Okay, but if you look in the gray, that was 1960, and you can see that the gray is over to the right and the blue is to the left. Okay, that's the average blood pressure. I would say that if I walked up to you, or any one of you walked up into your doctor's office and you had a systolic blood pressure of 155, I suspect your doctor would say you're hypertensive, right? And that meant that in the 50s, much of the population was hypertensive. Now, as a population, we're moving towards a normal tensive, and there's data that says 120 to 130 is the sweet spot for blood pressure. So we're moving to that, and that results in changes in both stroke, heart disease, and death. Okay? And in fact, since that particular report, it's continued to go down. Deaths due to heart disease, death due to stroke have continued to go down. And this is 2008. There's some recent data suggested maybe leveling off. There may be some issues of now new risk factors coming in that aren't being addressed. And we can talk about those if you're interested. But this is exactly what we can do to help our brains. Does that make sense? Now, this I alluded to early in the talk, and that is in the red is the white Americans, and in the other bars are non-white Americans. And this is the prevalence of heart disease and stroke for women and men. And what you can see is that by and large, except for Hispanic women, that people of color tend to have more vascular risk factors or more untreated. And I'll show you some data suggests that the real problem is a little bit is structural. That is, they're not getting the care that they need. They're not getting the early diagnosis. They're not getting the treatment. It's not that they can't respond to the treatment. They're just not getting to it for a multitude of reasons. Why is that important? This is a study by Christine Yaffe, and at that time, Deborah Barnes, I think, was a postdoc. This was a while back. What this suggested is that you could reduce the number of people with Alzheimer's disease, clinical Alzheimer's disease, by treating these particular disorders by a considerable amount. And that with combined physical activity, depression being the big ones, combined, it could lead up to between 10 to 25% reduction in the prevalence of Alzheimer's disease and dementia. Yes, sir. Yes, good. I'm glad we're getting this out of the way. Dementia is defined as someone who has impairments of their daily activities related to difficulties with memory or thinking. There are different forms of dementia. The most common form of dementia that's diagnosed in the clinic is Alzheimer's disease, which is due to plaques and tangles. But there are other forms of dementia: vascular dementia, Lewy body dementia, frontotemporal dementia. I could go on and on and on. The important point, as I was talking about, is that actually, in reality, that simplistic approach is no longer accurate, and that most people suffer with more than one problem. Okay? So dementia is a global term, an umbrella term. Alzheimer's disease is the name we give those people who we think have the plaques and tangles, the abnormal proteins of Alzheimer's pathology. Vascular dementia is the name we give those who have vascular disease as a predominant pathology that appears to be related to the syndrome. Okay, so this person, Donald Lloyd-Jones, and I think it's publicly knowledge now that he's moved from Northwestern to Bath BU and is taking over the Framingham Heart Study. I've been a Framingham investigator for 25 years now, And it's really an honor because this man has done some really terrific work. 20 some odd years ago, the American Heart Association said, we're starting to see some differences in we're starting to see the effects of normalizing blood pressure, cholesterol. How can we come up with a goal? And so he came up with national goals for cardiovascular health promotion and disease reduction. It was published in Circulation. This became known as Life's Simple 7. Okay? Life's Simple 7 is 7 simple things you can do in your life to reduce your heart risk. And what I'm saying to you tonight is that overlaps with some modification to your brain risk and your risk for developing dementia. Now, we're talking about risk, okay? And some of you can say, I'm a marathoner. I eat only, vegetables, and still I have a high family risk, and so maybe I'm having memory problems. I'm not saying that this cures Alzheimer's disease. It just reduces your risk. Okay. And so now it's been updated to Life's Essential 8. And what's been added to that is sleep. And we'll talk about both of these things, and we'll talk about all these things in just a second. Okay. And again, Donald Lloyd-Jones has been the leader in this. And in fact, I am also a member, if you see, I'm a fellow of the American Heart Association as well. And I will say that the American Heart Association and the National Institute on Aging and the Alzheimer's Association have all gotten together with this concept of healthy brain aging, and with this notion that these are two diseases that are very, very common as we get older. One of the things that is important to understanding this is that not only can you do these things with the Life's Essential 8, those are the gears up at the top, but that it also involves psychological health and social determinants of health. But this is important because just doing those by themselves is not going to have an impact on our society. Okay, we have to incorporate this into a broader picture. Okay, and some of that has to do with diminishing some of the social barriers that prevent good health in the United States and the world in general, to be honest with you. Okay, one of the most important ones is diet. Okay, and so I just have to share a few words with you about diet. Dietary habits show the strongest evidence that they can reduce cardiovascular effects, diabetes, and or obesity. Okay, good news. That recommended dietary patterns are based on foods rather than nutrients, which is a thing you need to be aware of. Okay, so it doesn't tell you are you getting enough magnesium or are you getting enough copper. It's just talking about the foods you eat. And the idea is that the inclusion of as few as possible elements, and what this means is if you're doing a diet, okay, be sure that you're not eating things that cross over if you're trying to balance your meal. Whoops. Okay. If you're trying to balance your food, try to eat things that are independent of each other. This is the diet that Donald Lloyd-Jones selected. I'll show you there's other diets. Fruits and vegetables, keeping your sodium low. And sodium sneaks in a lot of different things, you all. I mean, I realize that I'm a big soup eater. I have soup almost every afternoon for lunch. And so I have to be careful about my sodium intake because of soup. It is very clear that sugar-sweetened things are not good for you. And now they're talking about high processed foods. Have you heard about this too? Those things are not good for you. Those come in really interesting things. So it's okay to eat a potato. All right. You could slice it up. You can do it in the microwave. You could stir on it. When you fry it, it becomes a highly processed food. And yet McDonald's and some of these fast food restaurants are just, and fiber rich is really good. But the other thing is sometimes things like tomato soup, ketchup, there's sugar sneaking around too. Yes, ma'am.
The plant-based foods.
Yes.
Would that be considered processed? Because
no, plant-based diets are absolutely Okay, they're not processed. What is a processed food? Cheese whiz is a processed food. Okay, but sometimes you don't think about it, but some types of like hamburger buns, hot dog buns are processed food. So there is a whole literature on this. If you just talk about high processed food, if you just Google that, you'll get all of the things that are common. I would just say that if you find yourself going to a fast food where someone is free, then that's going to be processed food.
Okay, so I'm thinking about the like plant-based sausage, plant-based
Yeah, that's not
beef, that kind of stuff.
no, that's not processed.
Okay.
That's not processed in the way we think. Yeah. Yes, that's actually a good way. Although I will say that there's been a debate, and if you're calorie restricting, if you're calorie restricting, plant-based is not necessarily the best way to go. So there's been a comparison between hamburger and Impossible Burger. It turns out that they have about the same calories. It depends too. The coloring may be some processing, so I don't know. But a plant-based diet is very, very good. Okay. So other things you can do is eat nuts, legumes. I had to look this up. Are beans, peas, those kinds of things. Don't eat processed meats. Saturated fat. Okay, this is really highly debatable. There's a whole bunch of things going on about what means a saturated fat and what doesn't mean a saturated fat. And I don't want to get involved in that. I would just say that if you olive oil is not a bad thing, but there's coconut oil now. There's all kinds of stuff. So I'm just looking at what kind of fat you cook with. However, there are other diets, and this is two of them. The Mediterranean diet, which I think probably many of you have heard about. It's very popular. The biggest difference between the Mediterranean diet and the DASH diet is that it includes water and alcohol. Okay. And in my house, it's a little bit of water, a little bit of alcohol. But it is true that it's not that much different. They all have in common increasing your fiber, increasing fruits. That's one of the things I think we don't eat a lot of is fruits. California's a little bit better. And then one of my colleagues who's since passed came up with the MIND diet, and it's very similar. It just has slightly different emphasis on what fruits to eat, in particular, the emphasis on berries, blueberries, raspberries. And so that's just slight twists on the same theme. Okay. What about sleep? Okay. It's not about length. Okay. So if you sleep too long or you sleep too short, so it's what we call a U-shaped curve. There's an optimal time of sleeping. It's longer than you think. Well, you guys are probably all on top of this, but how many people say that 6 hours is plenty of sleep? Okay. How many people say 7 hours is plenty of sleep? How many people say 8 hours is plenty of sleep? Yeah, some people are raising their hands twice here. I see this. It really is 8 to 8.5 hours. It's not 7. That's what most people say. It's not 7. It's more like 8. But it's very important that it's about the quality of sleep. And particularly in the United States, a lot of individuals are being diagnosed with sleep apnea, which is a good thing because we're not having quality sleep. And sleep quality is really important. Things that help with sleep quality is cool down the room. Believe it or not, cold rooms work good. And also, all the things that you need to, make sure that you're comfortable. Importantly, it's also about oxygenation. And I'm going to spend a little bit of time talking about this because I think it's an important issue and it's so common. So what happens when we sleep? There's the tongue. It's one of the biggest, and it is, I believe, the strongest muscle in the body. It's a big thing. When you relax and fall asleep, sometimes the tongue falls to the back and compresses the pharynx. Okay, and that leads to obstructive sleep apnea. Now there are different forms of sleep apnea, but this is the obstructive form that I'm going to talk about because it's the most common. What happens Loud snoring, but snoring in and of itself is not necessarily, I'm sure that some of you have partners. None of you snore, of course, but some of you might have partners who snore. Grasping for air. If you wake up and it's not a panic attack, or it could be a panic attack because you're suddenly short of breath. Awakening with a dry mouth. Often people who have sleep apnea breathe through their mouth instead of their nose. Morning headaches, that's a very, very common, that improves with the day. So they wake up, the person will wake up with a headache in the morning and they'll say, oh, it's my coffee withdrawal headache. And they'll, drink some coffee, they'll get up and be about, and the headache will go away. And that reinforces the idea that it's a caffeine-related headache, but in fact, it's sleep apnea. Sometimes difficulty staying asleep because you're waking up all the time as your oxygen gets depleted. Excessive daytime sleepiness, particularly people falling asleep when they're in traffic. It's a big no-no. At talks like this, though, it's okay. You don't have sleep apnea. And particularly difficulty paying attention while you're awake, unless you have ADD, and then it's okay. And irritability. And so all of these things are contributing, but it is important to understand that this is affecting it affects your blood pressure, it affects your body, it affects your lungs or your heart and your brain. So risk factors, excess weight, but not necessarily. There are people who are thin, lithe folks who have sleep apnea, or there's also sleep apnea can be a presenting sign of some kind of problem with the oropharynx, okay? Your neck circumference, thicker neck, have narrow airways, tonsils, adenoids, other things that, and in fact, this is where children can have trouble with sleep, okay? That they will have enlarged lymph nodes, and that will cause obstruction. Being male, being older, and having a positive family history are all important. And this is really important. For any of you who travel, it's not okay to use alcohol sedatives or tranquilizers. Okay. Now, there's lots of people that get on the plane, they have 15 drinks, and they say, I'm going to sleep it away. Okay. These are not good for you. So, there was a period of time in 2000s, Ambien was really big. People were taking a lot of it, and they had a lot of problems with it. Smoking, nasal congestion, but also medical diseases, particularly heart failure. So I find that some of my patients have trouble sleeping, and it's because they have anemia, heart failure, or some other issue underlying. Here's what I want. If you're going to do anything today, go to that website, okay? mlc.heart.org. This is a way you can calculate your own cardiovascular health. And this is based on Life's Essential 8. And it asks about health behaviors and health factors. Okay. And it gives it's just like a speed dial. So you want to be in the green as much as possible. Okay. And why? Okay. This is a great study by the Regards group, which is reasons for geographic and racial differences in stroke. Regards comes out of the fact that we have a stroke belt. And this stroke belt starts in the eastern part of the United States, the Carolinas, Florida, and stretches all the way out to Arkansas. And for reasons that we don't really understand, people who live in that area have more stroke than anyone else in the United States. We don't know why that's the case, but one of the things that people did was to say, okay, let's take a look at how their health behaviors are. So they did Life Simple 7, and I didn't get into the details, but Life Simple 7 has 0, 1, and 2. 0 means your high blood pressure and it's not being treated. 1, you have high blood pressure, but it's not being accurately treated. 2, you don't have high blood pressure, or your high blood pressure is normal, or your blood pressure is normal on treatment, okay? Those are health behaviors, okay? And so the lower the number, the worse it is. And as you can see, that there's a variability of the numbers, but the whites tend to have slightly higher, slightly better overall health than the African Americans. Wait a minute, those got flipped. Yeah, they got flipped. Good, I saw that. What the authors did here is this. So there's not just a couple of people. There's 17,000. And one of the things I want to say that's happening in medicine these days is we are doing more and more large studies that are likely to be more representative. So the results are relevant to each and every one of us, even if the differences are small. Its impact happening on the population level is huge. Okay. So they were followed for about 10 years, and they were seen every couple of years. And what they found is that people who had poor health maintenance did much worse. So this is the percentage of people who became impaired over the 10 years. So you don't want to be up on that bar. You don't want to have a high number on that bar. And what you can see is people who had 0 to 6 points, okay, those are the people who are basically out of control in most of these areas, okay? And those who have 9 to 14 points or 7 to 8 points. And the point of all these points is really what you want to do is manage those things you can, but you don't have to be perfect. The big difference is going from uncontrolled, unmanageable, to having manageability. Does that make sense? It doesn't matter whether you're black or white. That were the only two groups they looked at. It also didn't matter. I'm not going to go through this whole list. It also didn't matter a bunch of other things that you had. It didn't matter what your kidney function was, your heart disease, et cetera, et cetera, et cetera. Okay. It just meant, did you do the best to maintain your health? This is work by our group on looking at what happens when you take this and say, all right, I'm going to ask the question, what is your conformity to ideal health, or what is your ideal health? And then I'm going to follow you 10 to 15 years, and I'm going to see everybody's normal here. 10 to 15 years later, what's happening to them? Okay. And basically what we found is that there was a reduction in stroke. There was reduction in all-cause dementia, particularly Alzheimer's disease. Okay. So in fact, if we come to an adult population who are in their 50s and 60s, and we see that those people have health maintenance, they do better. So this is relevant to this group. Okay. It's not something that you have to think, oh, well, when I was 16, I didn't run, I didn't participate in I don't know, whatever, some exercise activity. No, that's not what it's about. It's all about doing the best you can when you can. And then the other thing is, and I just say this because I'm a brain guy, it also had an impact on measures of cognitive ability. So people did better with pencil and paper tests. And any of you have been participants with us, you know that those pencil and paper tests we have, well, they did better. And also their brains were healthier looking. And then this is data from two different groups of diverse individuals, the Chicago Healthy Aging Project and the Soul Inca Project, to reinforce that this works in those people who have been studied independent of their social cultural backgrounds. Out of all those things you can do for yourself, okay, what can you do? Okay, the things you can do is make sure that if you have diabetes, you have the best treatment possible. Certainly getting your hemoglobin A1C below 7, ideally getting it below 6 would be, like I said, ideal. You can change your diet, you can stop smoking, you can control your blood pressure, okay? But the thing that we don't do enough and that can be done easily is exercise. And I'm not saying you have to be a marathon runner, or an Olympic skier or whatever. I'm saying get in 5,000 steps a day, 10,000 steps a day if you're really energetic. Okay, that 5,000 is about 2 miles. Takes about half an hour. You can break it up. You don't have to do it all at once. Just get out there, because it doesn't appear that you have to do a lot. That is, it helps at the low end, when people are not doing exercise, it helps the most. Once you get into the exercise group, it probably doesn't help all that much. So I'm getting towards the end here, and I just want to say that I alluded to this early on in our conversation about how the American Heart Association and the American Stroke Association have come together with this concept of defining optimal health, brain health, and but simultaneously it's being joined by the Alzheimer's Association. So there are large societies and others, not just these groups, who are really saying now's the time to think about not just your heart risk, not just your kidney, not just your abdomen, but your brain. Okay. And the way they put it together, and I think this is a kind of a simplistic, but I think it conveys things, is that there are genetic effects that we cannot modify. Okay. There are things that happen during development we cannot modify. But there are things in our environment, environmental exposures, behaviors that we can modify. They affect our optimal brain health. Things we can modify early in life that have to do with development, of course, is education, enriched environment. Okay. Giving to our children the gift of knowledge cannot be underestimated. It's a huge effect on the brain. Okay. What you also want to do is prevent things from happening. You want to prevent having diseases that affect the heart, brain, okay? Cardiovascular disease, cerebrovascular disease, and risk factors. And this can happen at the individual level. So you can check your health status, and that's why I gave you that link. I want you to check your health status. I want you to remain physically active and do all the good stuff, okay? At society level, we want to emphasize cognitive engaging activities and making the brain important in our society. Healthcare practitioners can recognize this and help to intervene or to advise. And then our health systems can work, and public health policy can make a difference. And then I talked to you about that early on in this conversation. I think our public health, the one thing you can do coming out of today is to be mindful that the people who make the laws keep the brain and good health, brain health in mind. And this is just to say that there are critical windows in which we intervene. And I really like this because it means going to the doctor when you know you're pregnant, or finding out if you're pregnant and getting the best health care while you're pregnant, intervening in early childhood, intervening in reducing social trauma during the developmental years, and then in middle age, preventing or addressing health problems, and then supporting our elderly through community engagement and community support systems. The idea here is to improve our brain, our cognitive aging, so we avoid dementia. And we can do that by reducing injury, but we can also do that by increasing our ability to have resilience. And that resilience is by education, by engagement, by avoiding social isolation, and exercising. And so the treatment of vascular risk factors is the one thing you can do today, no matter where you are in your life, no matter where. Okay? That's the one thing you can do right now. Science is moving along to treat Alzheimer's disease. I suspect that Lewy body disease will be next. There will be frontotemporal treatments for frontotemporal disorders. I mean, I think we're in a really new and exciting era of brain health care. But in the meantime, you can do the best to reduce your own risk by having the most healthy brain. And that Life's Essential Aid is a very good, straightforward system by which you can do that. So, don't smoke. You know, that's going to be hard for some of you. Watch your weight. I can tell you that is really hard for me. eat a healthy diet, exercise, control your blood pressure. Oh, and by the way, don't just take your blood pressure when you go into the doctor's office, because you'll say, you go in there and say, oh, my blood pressure's never like that. There must be, and they say, yeah, that's right. Everybody gets nervous when they come into the doctor's office. Take it at home and take it for a while, maybe a month or so. Control your blood sugar, control your blood cholesterol, sleep well. And this is all of them, all listed out for you. And with that is how you get a healthy brain. And then ways to get involved. I'll stop right here and start answering questions. But there's ways you can get involved with the Alzheimer's Disease Center, helping us to do these kind of things, to carry out the research that you heard about today. And that is to join our research registry. And I believe that Dr. Johnson can talk to you more about that. Obviously, you can always make a donation, and a donation can be in time, effort. It doesn't have to be just money, okay, or creativity. I think creativity is actually even richer than money. Join our workshops. We're going to continue to have them, and particularly our next Healthy Brain series. Thank you.